we will have a discussion on grief, not only specific to death, but loss of jobs, plans and gatherings, anxiety, depression, and when to seek help. Additionally, Dr. Gold will speak about mindfulness and stress management tools to help with coping. Dr. Gold is a clinical psychologist and assistant professor in the Department of Psychiatry and Behavioral Science at the Johns Hopkins School of Medicine. She received her PhD in clinical psychology from the George Washington University in Washington, D.C., while completing research at the National Institute of Mental Health in Bethesda, Maryland. She subsequently completed a 2-year postdoctoral fellowship in psychology at the Johns Hopkins University School of Medicine before joining the faculty. Dr. Gold is the director of the Mindfulness program at the Johns Hopkins University School of Medicine and associate director of the Johns Hopkins Bayview Anxiety Disorders Clinic. In addition to treating patients with anxiety and depression, one of her primary areas of interest is teaching mindfulness-based structure reduction and other mindfulness programs to patients, faculty, and staff. She is certified in mindfulness-based stress reduction through the UCSD Mindfulness-Based Professional Training Institute. She has led numerous clinical and professional mindfulness-based stress reduction groups and was the mindfulness-based stress reduction interventionist for a recent randomized controlled trial for patients with migraines. Dr. Gold was also involved in a systematic review and meta-analysis entitled Mediation Programs for Psychological Stress and Well-Being, published in JAMA Internal Medicine. She has lectured regionally, nationally, and internationally on the benefits of mindfulness meditation. With that in mind, I would like to turn it over and introduce you to Dr. Gold.
Thank you so much. Sorry for that long bio. I need an abbreviated version to send out. It's lovely to be here this evening and to be with all of you. Thank you for taking time out of your busy days to attend to this really important topic on mental health. And what I was hoping to do is just run through some slides on the on some of the relevant mental health topics, and then provide some opportunity for questions and answers. So I'm going to share my screen so I can show you these slides. Okay, let's see. Okay, so hopefully everyone can see that. So I would like, as Christopher mentioned, I'd like to talk today with you about some of the things I've been seeing clinically with my patient populations and how to address some of these issues. Obviously, there is significant stress, and that is manifesting in different ways for everyone. Anxiety has increased significantly. We're seeing increased rates of post-traumatic stress disorder and depression. Grief is a topic that I will touch on now, and then if there are more specific questions related to it, I'll expand. I have been using the term grief quite broadly these days, so it's not just the death of a loved one or a colleague or someone we care about, but grief of so many aspects of our lives, our jobs, changes in routines, changes in events we were looking for. And so I use that term quite broadly. All of these symptoms of stress can be normal. We're expected to have the blues and have some anxiety and experience grief. But when do we seek help, and when do we guide others to seek help? We really want to look for some form of interference with their functioning from these symptoms, some impairment in and functioning, or your own functioning. So when you start to notice that, I'm having trouble getting out of bed or doing my daily tasks because I'm feeling so anxious, that's time when we want to kind of seek further help. There is a colleague of mine, Dr. George Everly at Johns Hopkins, who talks about the emotional phases of disaster. And he and his colleagues have put together previously this graphic to show some of the phases of disaster. And the reason I show this is because I think it's important to normalize some of the feelings individuals have during situations like this. This was initially developed for a one-time disaster, say a Hurricane Katrina. But the difference with the current pandemic is that it's ongoing, so it's not just one event. But as you can see, what happens is initially after the impact of an event, we go through these periods of what he calls the heroic phase or the honeymoon phase, where we are empowered to help, and we feel energized to help others and come together as a community. And then that's followed by this steep drop in disillusionment, which is where I've seen a lot of patients more recently, where people start wondering, but how long is this going to go on, and this and being hit with these different continuous stressors. And then we have an opportunity to rebuild, but again, the challenge with the current pandemic is the uncertainty and not knowing when to rebuild. And so I hope today I can provide some tools to help with some of the anxiety and the uncertainty. But I show this because I really want to normalize. I even saw this in myself kind of initially the first few weeks. Okay, I can do this. I can adjust my schedule. I have energy to do this. And then I noticed, whoa, this is really going on for a long time and really impacting myself and others in ways that I didn't foresee. And so I wanted to just normalize those feelings for everyone. If you're interested in learning more about those aspects of disaster psychology and psychological first aid, if it applies to your field or you just have curiosity, the course that Dr. Everly put together is free on Coursera, and you can learn more about that there. So self-care during COVID, some of this is hopefully things that you've already been doing or you already know about, and I'm just going to reiterate them here. We want to try to get adequate sleep, of course, eat well, practice good sleep hygiene, limiting access to the barrage of information we are getting from the news outlets. So that is so stressful, and it's rarely good news. It's just one more thing to worry about. So thinking, can you find one news source and check it once a day, maybe twice a day if you have to, but we really want to limit the access to all of the information that's coming in. Social support, it can be very important during this time. Many of us are feeling very isolated. We do have to be a bit creative about how we engage with others. So of course you can use video and telephone. You may be in a space where you can have distance visits outside with friends and family, but really rethinking, how can I continue to build my social support during this challenging time? And really knowing when to ask for help. I think this is so hard for so many people to ask for help, whether it's yourself or you may see this in a loved one. And knowing that it is perfectly normal to need additional resources during this very unprecedented time. And where to ask for help. I'll talk about that a little bit later as well. But, starting with the easiest connections for yourself. And for many people, that might be your primary care physician, and just saying, I'm really struggling to deal with this, and going from there. So I want to focus specifically on an area that is my area of focus and something I found very, very valuable to add to your tools in your toolbox in terms of self-care. And that's mindfulness or mindfulness meditation. And I want to just briefly step back to define what this is before I talk about it in greater detail. So, mindfulness is paying attention on purpose in the present moment, non judgmentally. So, you may notice that during the stressful period, so much of your time and thinking is spent in the future, worrying about the future, in the past, ruminating about the past. And those things really take us away from the present moment and contribute to our distress. And mindfulness is a way to recenter us back into the present moment. And if we sit here and in the present moment, there may still be stressors. So it's not that the present moment is perfect, but we can distance ourselves from the story that the mind tacks on to an already stressful situation and to the uncertainty by coming back to the present moment. And I'm going to share with you how we can begin to do that. So the opposite of being mindful is being mindless or on autopilot. And most of us function in this way for much of the day. We're just going through the motions. And this can be really stressful. We don't recognize stressors throughout the day, and they just build and build and build. We miss out on pleasant things throughout the day because we're not paying attention. And it's also exhausting to always be on autopilot, to always be doing one thing with your thinking being elsewhere. So when can we practice mindfulness? This is a really popular term, this mindfulness, but we can, any moment during the day, we can pause and bring attention to the present moment using our breath, so doing breathing exercises. And if we have a few moments, I will maybe for 2 or 3 minutes, I'll guide you through a practice so you can get a sense of what I'm talking about. And then informally at any time during the day, you can just pause and notice where your attention is, and then bring your attention back to the present moment, usually in the form of your senses, or again, your breath, or some other aspect of the present. So let's talk for a few moments about ways to bring mindfulness into your day. At any point during the day, you can pause and take a few deep breaths. Okay, and these are ways, again, to recenter ourselves. So you're caught up in the stress cycle and the stress response. How can you just bring yourself back to this moment? Pause and take a few deep breaths. Bring attention to your senses. Our senses are always in the present moment. So anytime you're feeling stressed and you want to recenter back in the present, you can just notice what you're hearing, what you're seeing, what you're touching. Pausing before transitioning to a new task, maybe taking a few deep breaths before transitioning to a new task. Pausing before picking up your phone. Labeling your emotion. So if you can label how you're feeling and identify it, even if it's uncomfortable, I'm feeling sad or stressed or angry or irritable, it begins to lessen how intense those feelings are. Catch yourself when you're on autopilot and your mind is elsewhere, and bring yourself back to the present, and have something to remind you to practice some of these mindfulness tools. One of my favorite ways to bring some of these tools to daily life in a stressful situation is to drop the story. So when you are confronted with a stressful event, state the facts of that event in a sentence. And we're confronted with many stressful events these days. So an example might be, I don't know, if someone's going to come visit tomorrow, or I'm running late, or something, anything can be the fact. And then you notice those add-on thoughts that take you away from the facts. Oh, I'm running late. What if I don't make it to this, event or meeting? Some of these things were probably more applicable when we were all going places, but now many of us are at home. But those add-on thoughts that make a stressful situation even more stressful, and just come back to the facts. practicing gratitude is a wonderful way to reduce stress. And there are many ways to do this. One way is in the morning or before bed, just write down 3 things you're grateful for. Our mind tends to gravitate towards negative things, and during stressful periods it gravitates and latches on to stress, and there's an adaptive reason for this. It's that so we can survive, so we can plan when there is a stressor, we can figure out what to do. But sometimes there's nothing to be done and we can't solve the particular problem. And so it's useful to practice gratitude to bring ourselves back to what we're grateful for, as opposed to all the negativity that we're surrounded by. And this is actually a proven way to reset ourselves, and it's an antidote to some of the stress and anxiety. I run daily mindfulness meditation sessions for 30 minutes, and they're available to the community. They're free, and you are welcome to join in as a way to practice some of these tools. This would be an option, although there are many apps, and you can even Google mindfulness meditation, and tons of video and audio will come up. So it's up to you if you'd like to delve into this, how you can, what you can use, what tools you can use. But these are just some of the resources that you can begin to use to tap into your own ability to manage stress, in addition to hopefully other tools you already have, such as exercising and connecting socially. So I'd like to maybe just take 2 or 3 minutes to do a very brief practice so you get a sense of what the formal mindfulness practices are. I went through some informal ways to bring mindfulness to daily life, but I'd like to kind of show you what the formal mindfulness practices are, so you can see that it's a pretty simple concept. It's not easy, but it's pretty simple. So if you'd like to participate, just take a moment to find a comfortable position for yourself. If you'd like, you can close your eyes. And let's just take a few deep breaths together. Taking a deep breath in and a long, slow exhalation. And then when you feel ready, drawing the next breath in. And a long, slow exhalation. And one more time. Deep breath in. Long, slow exhalation. And returning your breathing back to its normal rhythm. And taking a moment to notice sounds around you. And notice sensations in your body. Maybe your body coming into contact with wherever you're seated. Noticing sensations in your hands and in your feet. And taking a moment to check in with how you're feeling emotionally. Just noticing and noting in a couple of words how you're feeling. And then bringing your attention back to your breathing. And we're not pushing any other experience away, but we're just noticing our breathing in its natural state. Breathing in and breathing out. Breathing in. And breathing out. When the mind wanders, we just gently bring it back to this breath and this moment. And with this next breath, see if you can be present with the breath from the beginning of the in-breath through the middle and to the end of the out-breath. When you feel ready, you can open your eyes. Perhaps take a moment to stretch out a little bit. And so if you've never practiced mindfulness meditation before, that was just a brief introduction to what mindfulness meditation is. So we brought attention to different aspects of the present moment. We don't push our other experiences away. We just choose to allow them to fade a little bit as we bring attention to a particular aspect of our present moment experience, such as the breath or sound or sensations in the body. So, with that, I will end there, and then I am open to answering questions, and I will let Christopher take it over.
Thank you, Dr. Gold. That was a very enlightening, inspirational, and humbling presentation. It was, well, I was trying to get back on video and mute, trying to bring myself out of relaxed state to get back to the conversation. I think that's a very inspiring presentation, and with practical steps that we can implement in our life, no matter if we are at home, working from home, at home with our family during this time, or in the office, like myself. So thank you. In advance of the presentation this evening, we received several questions from registrants that I would like to pose to you. And then we will give their opportunity for anyone who is joining us live to ask any questions also. The first question really, I guess, has to do with this whole concept of being mindfulness and just taking a moment to bring attention to our senses, to our awareness, to our state of being. Someone asks, what are your recommendations on calming down a situation that may be escalating out of control and that is impacting the mental health of individuals involved?
Mm-hmm. Yeah. So it's a stressful period, and if you're living with people in close quarters, there is more opportunity for the stress to manifest in terms of our interactions. So some ways to de-escalate a situation, I think, I guess first and foremost, making sure that everyone is safe, and if the situation is one in which you don't feel safe, making sure to try to remove yourself or those present. But following that step, I think that the greatest gift we can implement in these situations is to pause and take a few deep breaths before reacting. So what we want to do is pull ourselves out of that automatic mode of reacting to situations, which we do when we're stressed, and pausing and having an opportunity to see things from a different perspective. And that might be to remove yourself from the situation and do something that is recentering for you. Maybe you take a walk outside. Maybe you splash some cold water on your face, but anything to buy you a little time out so that you can remove yourself from the situation and approach it differently.
Thank you. The next question, they preface it by saying, I am a 67-year-old caregiver conducting senior home care. I have a 97-year-old client who lives solo in a 6th-floor building. What are your recommendations specifically to those who live alone as pertain to isolation due to COVID, or even another question someone asks about the disabled population?
Mm-hmm.
Any solutions or recommendations for those who are living alone during this pandemic?
Mm-hmm. Yeah, so thank you for that very important question, and also for the time you're spending to help our senior citizens. It is so challenging, I think, during this time to for the elderly population and disabled populations. I think we do have to think more broadly in terms of ways to help. And so if you are an individual who can help, um, uh, looking into opportunities to help these two populations, and first and foremost, taking care of yourself so that you are able to take care of others. From the standpoint of the seniors or disabled populations, I think so many things have gone virtual and are online, and so seeing if you or someone can help connect you with some of those online resources, whether it's religious services or community resources. And so we need to help our elderly and disabled populations learn some of that technology so that they can engage in some of those. So looking for the streamlined activities, helping with beginning to do some things via telephone, or if you feel savvy enough with video to stay connected with friends and family. There are resources online put together by different organizations, such as the National Council on Aging has put together resources for elderly during COVID. So depending on where you are, if you're a caretaker versus an elderly person or a disabled person, I think I would make those different recommendations.
Good, thank you.
Mm-hmm.
I'll read one more pre-submitted question, and then I will open it up to the attendees. If you have a question, I'll come to you next, or you can type your question in the chat box, and I will read that question aloud. Next question is, what are some of the benefits nature or outdoor public spaces bring to mental health during the pandemic?
Mm-hmm. Yeah, I've been encouraging many of my patients, if they're able to get outside, even if for a few minutes, and if they're not able to get outside, to just open the window, to listen to the sounds of nature, and feel and see nature. We know that from research that nature, being out in nature, can improve our mood. It can also decrease anxiety. And it's also an opportunity to kind of reset if you've been cooped up in the home all day, to kind of go outside, take some fresh air, and kind of be in new surroundings. So I strongly do encourage that. If for whatever reason you're in a place where you can't do that, and you can get online, there are some beautiful nature scenes that you can look at on your computer, although you wouldn't derive necessarily the same benefit as you would by being directly out in nature. but it could be kind of an alternate opportunity.
Good, thank you. Are there any questions from our attendees? If you would like to just raise your hand, if you hover over the Zoom app and click reactions, maybe you just want to give me a thumbs up. We can use that. I can call on you just for a matter of order, and you can unmute yourself, and we can move forward like that. Any questions from anyone attending for Dr. Gold? Okay, I see Neil.
They're going to call on you.
Please.
Call on you. Just talking to here and asking that question.
Neil.
Okay, I'm here. You put up a paper before about mindfulness, Monday, Wednesday, Friday, Tuesday, and Thursday, but I didn't get all the information. Can you put that up again? And where is it?
Absolutely. I will put that up again. And if you have a phone, you can take a picture of it or write down the link. That is virtual. I run them. I'm working from home, so I'm running them from my home, but it's via Zoom. So wherever you are, you can tune into it if you have access to the internet. So I will share my screen and I will put that back up for you.
Okay.
Mm-hmm.
Is this, by the way, is your presentation being recorded?
It looks like it is being recorded, yes.
Are you going to make it available to us?
That is perfectly fine by me. I don't have access to everyone, but would that be okay, Vanessa or Christopher?
Vanessa, do we have everyone's email address that we could provide the slides?
Yes, we do, and I can plan to share it with everybody following the discussion.
Okay, great. So, so what's the?
Can you?
Oh, okay. Yeah, daily. Okay, oh, yeah. Let me write that down.
Yeah, let me make it a little bigger. There you go.
Oh, this is super. And this with Nita. Hold on, I'm getting it all now.
Yeah, take
Okay,
your time. I'll leave it up for you, so take your time.
Okay, 9 Tuesday, Thursday. Okay, all right. So it's JH.
We have another question. We will leave the information regarding the daily mindfulness session on the screen. We can, this is actually a great question that just came through the chat. What is the difference between mental health first aid and psychology first aid?
Mm-hmm. Yeah, great question. So the psychological first aid slide I put on is basically some tools that are used for as mental health practitioners or anyone who kind of gets trained in that to provide to individuals during a disaster or epidemic or a major stressful event such as this. So it is one way to work with to address mental health needs during a pandemic. The other tools that I mentioned, such as mindfulness and self-care, are other aspects. So you don't need to know anything in particular about psychological first aid unless you want to learn more about it, but it teaches tools such as how to be a compassionate listener for someone who's been through a challenging time, and to help people through difficulties.
Good, thank you. And again, please feel free to raise your hand or give me a thumbs up if you would like to ask a question. Another question that was submitted during registration is, how can individuals deal with PTSD due to near-death experience with COVID-19?
Yeah. So PTSD, for those of you who aren't familiar, is post-traumatic stress disorder, and it is an anxiety disorder that can develop in some individuals following a traumatic event, and certainly near death from COVID is a traumatic event. Often the symptoms are some form of increased arousal, heightened startle response, flashbacks, nightmares to that event. Some symptoms of traumatic distress after an event can be normal and will remit on their own. If you've noticed that yours have not, I think the best way is to speak with a professional, a therapist, to learn ways to deal with that experience. And you can, again, start with your primary care doctor and say, I'm having trouble dealing with this. I need some help. Or you can, call your insurance and get the name of some therapist directly if you'd like. And in some cases where the PTSD is prolonged, medication, antidepressant medication can be warranted and can be helpful. I think the thing to remember is that these are, it is treatable.
Good, thank you. Another question that was submitted. I feel isolated and lonely. How can I find connection while quarantined or at home?
Yeah. And so many people, just know that so many people are feeling that way, and you're not alone in those feelings. I think that the best way is to think a little bit more broadly about how you can begin to reconnect with your social connections. So yes, we might not be able to do things exactly as we did, but are you able to have a neighbor come and speak with you from a distance on your driveway if you're wearing a mask? Are you able to call individuals that maybe you haven't connected with in a while, or do video calls with them if that's possible for you? Can you connect with the online hobbies or activities that church services, for example, that are virtual now? And even just going outside and waving to a neighbor from a distance can help diminish that sense of isolation. If you're on the flip side and of people who are living alone, please do make that extra effort if you're able to go just to say hello from a distance, call and ask if they need anything. And that goes such a long way.
Thank you. Another question is, I have been feeling down and depressed. Any tips to help my mood?
Mm-hmm. Yeah, again, very common these days. You're not alone in feeling down and depressed. It is a challenging, incredibly challenging time. Yes, there are, many things you can do to help your mood. One is to engage in activities that bring you joy, and to engage in activities even if you don't want to push yourself to do things, creating some form of structure and routine, even if you don't want to. So sometimes we have to push through it and we feel better afterwards. Exercise, if you're able to, can be great. The socialization can be great. In some cases, again, if you're feeling like these minor tips don't make any difference and it's pretty severe, your depression, then I think you want to talk to your primary care doctor. And again, there are lots of therapies and medications that can be helpful. But to begin, you can just try creating some form of structure for your day, maybe writing out, okay, I'm going to wake up at this time and I'm going to do this, and making sure you incorporate something that is pleasant for you during the day, even if it's little, and some things that give you a sense of accomplishment each day, and take baby steps.
Wow. What advice would you give someone who is currently working from home and feeling disconnected from their routines?
Mm-hmm. Yeah, many of us are. I think that it's really important to try to create some semblance of your routine at home. So if you woke up at a certain time for work, trying to maintain that schedule. And really, I think it's important to have some sort of schedule where you block off times for certain things and write that down so that your day doesn't feel so disconnected and amorphous. So making sure, from 10 to 11, you're going to do this. From 12 to 12:30, you're going to take a break. And again, incorporating fun things, but really seeing, can I create that structure that I had for my work day to some degree at home? You might even want to create some sort of space for yourself at home that feels like an office space. And don't forget to take breaks during the day.
Again, if there's anyone joining us live, please feel free to raise your hand, give me a thumbs up, and let me know that you have a question for Dr. Gold. Okay, Adriana, I see your hand, so please feel free to unmute yourself.
Great. Thank you so much for doing this presentation. It's really helpful, and I really appreciated the mindfulness meditation. I've got to do that more often. I'm writing a story about, or an article about the mental health challenges of COVID. So this was a really good topic. And I'm concerned about some of the long-term effects that this experience will have on all of us, but particularly those among us who have mental health challenges. So what would be your perspective on that?
Mm-hmm. Yeah, thank you for your question and for also writing, writing about this topic that I think is so important during this time. I guess, we don't know what the long-term consequences of this will be, but one way I think about it is that we have individuals who are already vulnerable and then placed in a environment of a chronic stressor, basically, and that really can lead to worsening of symptoms. And for many people, I've seen a new onset of symptoms, of psychiatric symptoms that they may not have experienced. And I think we really need to be mindful of beginning to set in place any tools and resources that we think could be helpful for individuals struggling. And that includes connecting individuals with others to know that they're not alone, teaching them these tools such as mindfulness and stress reduction, and really importantly, making them aware of the resources that are available for mental health treatment, and kind of getting ahead of the game by intervening early if possible. At Hopkins, for example, we've developed a COVID mental health task force, and we're trying to really make ourselves accessible to the community so that people know they can get in and see us. I'm running these daily groups. We've started groups for employees there so that they can, take care of themselves so that they can better take care of others. And I think right now we don't have like a huge onslaught of individuals, but our thinking is that this is going to increase. The mental health needs are going to increase, and so let's put these mechanisms in place so that if and when that happens, we're ready. Yeah.
That's great. I'll look into what you're doing, and I really appreciate that. Thank you.
Yes, thank you.
One of the attendees upon registration submitted a question about dealing with constant work stress, and then also in the chat box, someone also asked a question about any suggestions that you may have for individuals. I think they are men who are responding to COVID. Individuals that are coordinating testing, individuals who are ordering supplies, organizing reopenings for their business. What recommendations do you have for these individuals so that they do not get stressed or overwhelmed?
Yes, yeah. Well, yeah, thank you to all of the individuals who are on the front lines in different capacities and to make our world a better place. And what I would say is, I think that you want to stay informed in terms of what to do and stay safe as you're engaging in those tasks. And so that might mean, being in contact with your organization and seeing what safeguards they're putting in place. So being informed, recognizing that there is some uncertainty and that, there are things you won't be able to necessarily plan for, and taking time for self-care, I think, is even more important if you are on the front lines and constantly bombarded with some of these stressors and the uncertainty, or with the person who has the chronic stress. I think we have to look at this time period and situation differently than any other time of our lives. You know, many of us might say, well, I'm working from home and I should be just as productive. And yet you have kids in the background, or you have an elderly person you're taking care of. We need to change our expectations of ourselves and treat ourselves with greater kindness and care during this time, as well as others around us, knowing that everyone is struggling in their own way. So I think focusing on self-care, recognizing that things may not get done exactly as we would like them to, so leaving some room for flexibility and compassion for ourselves, and for the frontline staff, staying informed and connected to your colleagues to be able to share your experiences with people who are also in the same boat.
Thank you. Again, if anyone has any questions for Dr. Gold, please type them in the chat box or raise your hand. There were also a question in the chat box and came through pre-registration regarding mental health resources in the county. So in the chat box, I placed a link to Montgomery County's COVID-19 information portal that provides mental health and wellness resources for children, for teens, for adults, for seniors, etc. So I encourage you to visit that website in order to get more information on what the county is doing to address the impact of mental health and wellness as it relates to COVID-19. Let me check to see if there are any other questions coming through, people raising their hands. Dr. Gold, another question that was submitted as part of the registration process, when should I speak with a therapist, and where can I find one?
Mm-hmm. Yeah, excellent question. It is a hard step if you've never seen a therapist to take that step to begin to meet with one. I think that if you're really feeling like the symptoms you're experiencing are beyond just kind of normal stress, and they're really getting in the way of your life in some way. You're having trouble getting out of bed in the morning. Your anxiety is so high that you're unable to complete, daily tasks, or you're, snapping at your family members a lot and feeling really irritable or unable to sleep. Little doses of this is, of course, completely expected, but if you're really seeing this is getting in the way of your ability to function, then that's when we want to talk to somebody. And many people like to start with their primary care physician because you have the easiest access to that person, but you certainly don't have to go that route. You can look on your insurance and for mental health benefits, and then find some therapists that are nearby. Many therapists are doing their sessions via Zoom or telemedicine, so you don't actually have to go in. I would say most therapists are now doing that. And there are also various crisis lines that you can call if you just feel like, I just need someone to talk to. I don't want a therapist. I don't want to commit to that. I just want to talk to somebody. And I believe I even saw some great ones on the Montgomery County website where Christopher, I think, posted. The Montgomery County Mental Health and Wellness website has some resources for Montgomery County residents. So there are options, and I think it's wonderful if you can take that step and just get somebody neutral to help you through this very challenging time. We all need it at some point in our lives.
Good, thank you. We have about 8 minutes here, and want to give anyone else who has a question an opportunity to do so. Please type it in the chat box or raise your hand. Dr. Gold, I'll ask one more question, and then if seeing no further questions, given that we're up against the hour, I'll ask you for some closing thoughts.
Mm-hmm.
And I guess this last question here is timely. Given the uncertainty with the coronavirus, we in the county are increasing our testing efforts so that we can identify and isolate and track down the virus. And so how do I deal with the uncertainty of what
It's not over.
will happen
It's not over.
as a result of the pandemic?
Yeah, that's a good question. Uncertainty is challenging. You know, our brains don't like uncertainty, and there's a adaptive reason for that. If we're uncertain about what's
Did you say something about a chat board?
yeah. And we can't, if we're uncertain about what's to come, we can't prepare and protect ourselves. And so it's very normal to feel anxious in times of uncertainty. So how do we deal with uncertainty? I think on the one hand, we can stay informed. So again, maybe checking the news once a day, not reading, not having it on in the background all day. And then secondly, come back to the present moment. So for me, so some people might go out and exercise and distract themselves with some activity, and that's all terrific. Do what works for you. For me, I really like the mindfulness tools because I can recognize that my brain is getting caught up in a story about the uncertainty and try to fill in the holes. And usually during stressful times, it fills it in with catastrophe. And so if I can recognize that my brain has a tendency to do that during uncertain times, I can come back to the present moment and often say to myself, this moment is the only reality. And that helps me not get sucked into that cycle of worry and catastrophic thinking. So and that's a mindfulness tool. So I really like the mindfulness. It's a way to train the brain to come back to this one moment.
Good. Thank you.
Mm-hmm.
Any closing thoughts, Dr. Gold?
Well, you know, I think in terms of closing thoughts, I think remember that there are things you can do to address your mental health concerns, and that there's nothing wrong with you if you're having a difficult time during this period. Everyone is having a difficult time in some capacity. It's coming out in different ways, and there are resources and tools to help that you can implement yourself, or you can reach out to others for help. And I think that's the most important thing, to recognize and know that it's okay to get help for mental health, and it is not a sign of weakness.
Good. Thank you. Well, thank you, Dr. Gold, for that very enlightening presentation. You gave us some great practical tactics that we can take back to our place of residence, to our place of work, that we can implement to ensure that we maintain optimal mental health. And on behalf of Public Health Services, Montgomery County Department of Health and Human Services, Healthy Montgomery, in partnership with the Montgomery County Commission on Health, we would like to thank Dr. Gold and everyone that joined us this evening for our COVID-19 community conversation to address the impact of COVID-19 on mental health. Please stay tuned to your email box for future community conversations, such as advanced care planning and end-of-life decisions. And we thank you again, and please have a great evening. Thank you.
Thank you so much. Bye-bye.